7 Surprising signs and symptoms of lung cancer. Because lung cancer develops in the lungs, as you might expect, its most common symptoms involve the lungs. A persistent cough, coughing up blood or excess mucus, shortness of breath, and chest pain are all common signs of lung cancer. The presence of these symptoms does not mean you have lung cancer, as they can also be caused by other conditions. This is why it is important to be evaluated by a doctor as soon as possible. Here are 7 other symptoms of lung cancer that have nothing to do with the lungs. 1. Using nail and/or toenail batons. Fingers or toes become enlarged when excess soft tissue forms under the nail bed. This causes a change in the way the nail comes out of the nail bed. In a normal finger or toe, there is a small V-shaped angle between the nail and the nail bed. In a clubbed finger or toe, there is no V-shaped angle because tissue has built up and covered the area. Clubbing fingers or toes occur in many medical conditions, including lung cancer. One clue for doctors that clubbing could indicate lung cancer is when the fingers are also contaminated with nicotine. The club takes place in phases. With clubbing in the early stages of lung cancer, the fingernails may be soft and the surrounding skin may be shiny. Fingernails may curl more than usual when viewed from the side, and fingertips may become larger than normal. Clubbing associated with late-stage lung cancer can cause areas of extra bone to form along the knuckles of the fingers and wrists. Clubbing is one of many symptoms caused by substances, such as hormones or proteins, secreted by cancer cells. 2. Pain, weakness, and/or numbness in the arm and shoulder. Lung cancer can also metastasize from the top of the lung, causing tumors in the brachial and/or shoulder nerves. These tumors are sometimes called Pancoast tumors. Symptoms associated with Pancoast tumors are known as Pancoast syndrome. These symptoms may include shoulder pain that radiates to the inner part of the shoulder blade, the large flat bone that covers the ribs in the back. The pain may eventually spread to the inside of the arm, elbow, little finger, and ring finger. Other symptoms of Pancoast syndrome include upper arm swelling, chest tightness, tired, unexplained weight loss, weakness, muscle loss or lack of hand coordination, tingling or numbness in the hands. The pain of Pancoast syndrome can become so severe that prescription pain medication is needed to relieve the pain. 3. Loss or hoarseness of voice. Difficulty making sounds or unusual changes in speech sounds can be symptoms of early-stage lung cancer. In advanced cases of lung cancer, voice loss or hoarseness is a common symptom that can be caused by a number of factors. Lung cancer can affect or damage the nerves that control the larynx, voice box. Also, if a tumor extends to the area between the lungs, it can put pressure on the larynx. People with lung cancer often have a chronic cough, and for a long time, they may even lose their voice. Each of these factors can cause your voice to change or disappear altogether. The most common cause of voice loss is laryngitis. However, if you have hoarseness or loss of voice for more than 2 weeks, you should consult your GP. 4. Swollen and discolored upper body. As lung cancer spreads, it sometimes creates tumors that restrict the large vein that carries blood from the head and arms to the heart. When this happens, blood flow slows, causing blood to pool in the veins. Excess fluid can cause your face, neck, upper chest, and arms to swell. The skin in these areas may also be bluish-red. Swelling can develop quickly or slowly. However, the initial symptom may be swelling of the face or eyes in the morning. If you have explained the swelling does not go away on its own, you should talk to your doctor about the condition. 5. Thirst and frequent urination. Thirst is common when the weather warms up suddenly, but sudden intense thirst is a symptom that you should always discuss with your doctor. Some lung cancer tumors make a protein that acts very much like the parathyroid hormone produced by the parathyroid glands. The parathyroid glands and kidneys normally regulate calcium levels in the body. Cancerous tumors can disrupt calcium regulation and lead to too much calcium in the blood. Having a higher than normal blood calcium level is called hypercalcemia, and about 10 to 20% of people with cancer have hypercalcemia. High calcium levels are associated with increased thirst and frequent urination. 6. Desire and ability to quit suddenly. It's certainly the most ironic warning sign of lung cancer. Most smokers have difficulty quitting. However, some lung cancer patients eventually quit smoking before being diagnosed with lung cancer. While many patients quit in the hope of improving symptoms such as coughing or shortness of breath, many patients suddenly find it easier to quit. Since the patient is suddenly able to quit smoking easily, this symptom is likely caused by cancer-related changes in the body. A study published in the Journal of the International Association for the Study of Lung Cancer concluded that 48% of the 115 lung cancer patients they assessed had quit smoking spontaneously and with very little effort before being diagnosed with lung cancer. Researchers believe that early-stage lung cancer tumors may secrete a substance that blocks nicotine addiction. 7. Horner's syndrome. Horner syndrome can also be caused by a Pancoast tumor. Horner syndrome is caused when the tumor affects the nerves leading to the eyes or face. Signs of the condition may cause drooping eyelids, reduced sweating on the affected side of the face. This symptom is associated with advanced lung cancer cases. It occurs after the cancer has spread to the nerves in the neck. Once the cancer has spread to the nerves in the neck, the side effect is facial paralysis.